So we have a lot to tell you about Matthew Perry. We have developed some interesting stories here. I got to say, this is such a case of betrayal. Betrayal by doctors, betrayal by his personal assistant. The personal assistant, by the way, after reading the documents, the day Matthew Perry died, his assistant shot him up with ketamine at 8:30 in the morning. And then later that morning, Matthew Perry looked at him and said, "Shoot me up with a big one." And he did, as he prepared the hot tub for Matthew Perry, which is where he died. But we are now learning this goes way beyond Matthew Perry.
Right.
I mean, we kind of knew it did, but they have laid out some really interesting and damning information in some of these documents.
About the defendants who their tentacles as far as the drug world in LA seem to reach pretty far. Speaking of the ketamine queen, or as the U.S. attorney dubbed her, and I think they got that title from people around LA, Jasveen Sangha, who is...
She has the title for a reason.
Yeah, based on what the authorities found in her home, which they said was a stash house, a drug emporium.
But what's interesting is that we found that just several months ago, unrelated to Matthew Perry, she has been charged with other drug crimes. They raided her home, and I am telling you, it is eye-popping what they found. They found coke, they found Xanax, they found meth,
ecstasy.
They found ketamine, they found ecstasy.
Mushrooms also, yeah.
This is not just for Matthew Perry. I mean, Matthew Perry got ketamine.
Got ketamine.
But you look
all
at...
that other stuff was going someplace.
It was going
there
someplace.
Were people who were buying it.
And there were facilitators. We know doctors were facilitators with Matthew Perry. We know there was a broker that facilitated Matthew Perry. So this is a much bigger issue, and an issue that involves people with means, because they were charging a lot of money for all of these drugs.
Right. So who are they dealing to? And you know, the first thing you think is there must be other celebrities involved here. Now the authorities have not said that, but it does feel like
there are. There just simply are. We've done documentaries on this. Yeah. You know, from Michael Jackson to Prince to all sorts of people, where, you know, Mac Miller, where doctors and others facilitate this.
Yes. Someone who is dealing with a lot of the addiction issues that are plaguing people in LA in particular, Dr. David Mahjoubi runs a ketamine clinic where they deal with people who are dealing with addiction, but also they also do ketamine therapies there. So Dr. David Mahjoubi is joining us right now. Welcome to TMZ Live, Doctor.
Hi, guys. Thank you for having me.
We got to start with ketamine. That, you know, we've heard about cocaine and all sorts of other drugs. For some, this seems out of left field that ketamine is a thing, you know, among celebrities and others. How did this happen?
Well, you know, it's been touted as a brain vitamin, and in many ways, it is in controlled amounts. It can actually help increase connections between your brain cells. But like almost anything, it can be abused, overused, and you know, if it's mixed with other substances. Matthew Perry was on buprenorphine, which is an opiate, and also if you get too much of the substance ketamine, things can happen. So you know, I think a lot of people are saying, well, that's good for me, and it you know, gives me a break from my reality, and so you know, it's a popular drug now.
Are you seeing at your clinic, obviously you're dealing with people who are addicted, but are you, as far as what you saw yesterday with the U.S. attorney coming out and revealing what all the information on these 5 defendants, the fact that there were 2 doctors so heavily involved who were saying such callous things as, let's see how much this moron will pay for this ketamine, was that shocking to you, or was this sort of stuff that you've heard over the years?
Yeah, well, you know, since COVID, the number of ketamine clinics has boomed. And because of COVID, the DEA relaxed certain rules that allowed patients to not come into a doctor's office to get ketamine, and allowed patients to just do a video consultation with a physician to get ketamine. Once that happened, you had all these online companies, all these tech companies providing ketamine to people at their homes, sending it to people's homes. And then a lot of physicians as well as nurse practitioners looked at this and said, wow, there's huge potential for profit. I'm going to get in on this. And so I'm not surprised. I even know of physicians who were overcharging um, Mr. Perry and do overcharge many celebrities because they have money. And so, unfortunately, there's a lot of greed in the ketamine world, just like there is in many other industries as well as medicine overall.
We did a documentary on Michael Jackson, and he had a dozen doctors who were fueling his addiction, making a lot of money in the process. And I was shocked up to a point, and then I just looked at it and said, my God, this is rampant. I'm wondering how brazen this is in terms of what you've seen, that doctors know what they're doing. They know people are getting either addicted or they're taking dangerous levels of it. But there is this kind of network. The way I saw this Michael Jackson network, is that network going on, especially, I'm interested in Hollywood, where people know where to go.
There's definitely an underground network to this. So as a physician, when I prescribe ketamine, I first check a database called Cures to make sure they're not getting ketamine from any other physician. And sometimes I'll see on this database that they are, and I'll call the physician. I'll be like, hey, do you know your patient's doctor shopping? And a lot of times some of these physicians and nurse practitioners say, no, I never checked the database. That's actually required for us as physicians to check this Cures database, this controlled substance database, to make sure patients aren't doctor shopping. So when now that I've been seeing this for many years with doctors not checking the database, I can see the greed is out of control. And I've never heard of these two physicians that were arrested, but I'm not surprised, to be honest.
What you just said about that database is interesting, because it would only show up in the database if someone were obtaining it legally through a prescription. But you have people like the alleged ketamine queen, who is not a doctor and has a stash there at her house. So you wouldn't have any way of knowing that someone like Matthew Perry maybe got a bunch of ketamine from her if he came into you, right? That's a loophole in the system.
100% there's a loophole. I know she got vials, so apparently she was getting it from somebody. Well, I think a physician was selling it to her, right?
Right.
Who
Yes,
ordered
that's what the authorities
from
said.
a wholesale distributor. So, that wholesale distributor, oftentimes they do background checks. So I don't know what went wrong there, but yes, someone's getting it off the street, whether it's, compounded ketamine in a laboratory or the vials. There's no way of knowing. I do know or heard that Matthew Perry was going to different physician clinics, and maybe he realized that he was able to get more ketamine through the underground world. About 5% of my patients, none of my patients are addicted, by the way, but I do have to discharge a couple of patients a month due to overuse. And I also catch them doctor shopping. So I'd say about 5% of my patients do doctor shop, and I catch them. Right.
It's interesting. The medical board has been radio silent on this. Are they doing their job in monitoring and enforcing regs when it comes to doctors in this?
I don't want to say anything bad about the medical board. They control my livelihood.
Well, you just answered. You just answered.
I know they definitely look. I know of, actually, let me backtrack. I do know physicians that have been investigated by the medical board. So I do believe they're doing their job. I think the one thing that can be done is the DEA reversing this rule that they relaxed 4 years ago due to COVID, and making it a requirement that patients come into doctors' offices to get controlled substances, whether it's an opiate or ketamine, and not doing it via telehealth, via video consultations. That would prevent a lot of addiction to ketamine, but some people will slip.
The thing is, that's become a business now. And, I know what you're saying, and it's definitely more subject to abuse, but telehealth is a business. I don't know how you're going to stop that,
That's true. They were going to stop it, actually, for ketamine last November. And I think some of the big companies and some patients came to the DEA and said, let's put a moratorium on this for a year and decide on it in November 2024, which is coming up. So, but again, they were going to actually do away with telehealth for ketamine last November.
Yeah.
All right.
We so appreciate you
Wow.
coming on.
There's a whole other
Of
world
course,
there.
thank you. for having me.
Wow.
Thank you so much, doctor.
Thank you, doctor. Appreciate it.
Bye, guys.
It is, this is a way bigger problem than just the Matthew Perry
Yes.
case.